Magandang araw mga kaibigan. Ito po ang inyong lingkod, si Dr. Arle Macasiano Imperio. Ako po ay nasa Family Medicine, Public Health, Traditional Chinese Medicine at member po ako ng Institute of Functional Medicine. Ang topic natin sa araw na to ay tungkol po sa acute and chronic diseases. Ano po ang pagkakaiba ng acute sa chronic? What are the differences? And of course, how are they managed? Ngayon, ito po yung pinaka pagkakaiba o kaya fundamental differences. Acute and chronic diseases, what are their fundamental differences? Yung acute disease mga kaibigan, ito po ay isang medical condition na nangangailangan po ng immediate attention at usually ito po ay nasa emergency ang sitwasyon. Kaya nga acute. Minsan nga sinasabi pagka-acute, yan po ang nakakatakot o kaya nakakatakot. Halimbawa ng mga acute diseases kagaya ng heart attack, ganyan, stroke, o kaya asthmatic attack, o kaya na aksidente, nahulog po. Pagkatapos nabali po yung kanyang paa. Aba, walang choice kundi dalhin sa hospital, di po ba? And then another important point sa acute diseases, ang mag-handle po ng problema, usually mga eksperto. Halimbawa, kung heart attack, kailangan internist o kaya cardiologist. Pagka-stroke po, kailangan po neurologist. Pag-asthma, pulmonologist. Kailangan ng expert sapagkat yung atake hindi biro. Halimbawa, nabali ang paa, di orthopedic surgery yun kasi kailangan ikabit yung fracture, and then usually this is done through surgery. Ngayon, sa mga acute cases, usually a cure is possible. Ngayon, yung chronic naman po, medical condition din po yan. Kaya lang ang focus po niya ay long-term healing, recovery, management of symptoms na pwedeng paulit-ulit nangyayari, improvement ng quality of life ng pasyente, at ito po ay long-term, generally more than 3 months, and it may even be lifelong. So halimbawa, high blood pressure, para makontrol po yung high blood pressure, kailangan tinututukan po yan. Ganon din po yung cholesterol, yung sugar sa diabetes, asthma, arthritis, autoimmune disease. Yung autoimmune disease, nagkakaroon ng flare-up pagka umatake yung mga white blood cells sa sarili nating katawan na hindi man dapat magkaroon ng atake. Paulit-ulit po yan. Yung autoimmune, parang yung mga sundalo na nag-awol at kinakalaban yung mga kasamahan niya. Parang nag-amok. Ganyan ang autoimmune. Obesity, geriatric o kaya aging patients. Ayan, matagalan po yan. So yan po ang mga sinasabing chronic condition. At we also can describe it as degenerative disease. Bakit? Pang matagalan, and then habang tumatagal, siyempre tumatanda yung pasyente, nagiging parang degenerative condition na po. So nakita niyo po pagkakaiba, yung acute emergency, yung chronic usually long term, and then the goal is the improvement of the person's quality of life. Ngayon, if we will go further, halimbawa sa acute diseases, we would mention examples, pero ang importante po yung focus. Yung target of focus acute diseases is to effect cure, fix, get things done, to bring things to normal as quick as possible. So kita po yung normal meron pong italics. Tama ba yun? Sapagkat usually di bumabalik talaga sa totoong pagka-normal, pero as normal as possible ang ibig sabihin yan. And it involves a specific system or organ. Halimbawa, heart attack. So una, gamot, baka makuha. Pero kung hindi, kung bara ang problema, angioplasty o kaya coronary bypass, surgery po yan. Talagang major surgery po yan. O kaya, kung posible, is to have a heart transplant. So yan ang focus, talagang aayusin. Stroke. O para lalo na kung hemorrhagic stroke, to immediately stop the bleeding in the brain, brain surgery, craniotomy, bubuksan po yung skull para makita po yung brain and immediately stop the bleeding artery. Kidney failure, where emergency dialysis is required, or to do a kidney transplant. Okay, talagang aayusin kagad. Hip fracture, kunyari na nagkaroon ng fracture sa hip, which is common. Para makalakad uli yung pasyente, hip replacement is done. Okay? So, ganyan ang focus sa acute diseases. Yung focus naman po sa chronic diseases, ang key idea is recovery, healing, yan ang keyword. Halimbawa na stroke. So, from the acute phase, magiging chronic siya, gano'n din ang heart, kasi pang matagalan, di ba, mayroon neurological deficit yung stroke. Humina yung katawan. So the goal now is to improve the quality of life, the management of symptoms, and if possible, to restore the basic movement or function. So dito ang focus supportive at it needs the decision and active participation of the patient. Doon sa acute, after the patient or the family gave consent, ang nagdidesisyon na kung ano talagang gagawin ay yung expert, let's say, a physician, expert in the field of specialty. Kung neurosurgery, cardiosurgery, siya na ang bahala kung ano gagawin niya. Pero dito sa chronic conditions, kailangan ng active participation of the patient. Tuturuan ng pasyente, didesisyonan ng pasyente, ifa-follow up, involve ang pasyente sa recovery. And then usually ang focus, healthy lifestyle, healthy nutrition, counseling, to cover mental and emotional well-being. Ngayon, how are acute and chronic diseases managed? So, nabanggit natin kanina, sa acute conditions, the focus is on cure. The expert decides on what to do. And then sa medical, usually emergency drugs are used. And then pang hindi makuha sa medical, surgical. So surgery to repair. We do surgery to take away the tissue or organ, or we do surgery for organ transplantation. So yan ang management ng acute diseases. Yung chronic, nabanggit natin kanina, the focus is on healing and restoration of function. And the patient participates in the decision making. Kaya kunyari na stroke, na heart attack, kailangan ng rehab o kaya rehabilitation medicine. This is a series of exercises designed to recover whatever strength one has previously had. And then kung kailangan ng gamot, the proper use of maintenance drugs to regulate or control symptoms. Supportive care po at nutritional counseling and healthy lifestyle counseling. So dito mahaba o matagal o kaya continuous yung patient relationship and interaction. Ngayon, may tanong, can dietary nucleotides help? Para maintindihan natin that it can possibly help, kailangan i-review natin yung Central Dogma of Biology of Life. Ngayon, ipapakita natin that dietary nucleotides support the Central Dogma of Biology. Ngayon, i-review natin yung illustration sa bandang kaliwa. So nakikita niyo po yung cell. Diba? Laki-laki ng cell. No? Pero yung bilog sa loob, nucleus, pinalaki rin po. And then sa loob ng nucleus, nakikita niyo, basahin maigi, DNA. And then yung DNA nag-unwind. Ang tawag yan, DNA replication. Pagkatapos, na-create yung messengerial RNA. Pansinin po ninyo yung DNA double strand. And then yung RNA single strand. Pero ang nangyari dito, kinopya yung code sa DNA, yun na po ang RNA. Ang tawag niyan transcription. So nakikita niyo sa bandang gitna, yung nakapula. DNA transcription. Pagkatapos po, yung RNA na yan, lalabas sa nucleus. So nandun na siya sa cytoplasmic area. And then makikita niyo po, kumakabit yung amino acids. Okay? Ang tawag ngayon yan, translation. To create the protein. So yung Central Dogma of Biology or Life involves three major elements. DNA, RNA, protein. Ngayon, pagdating sa protein, halos that already supports the entire body kasi the entire body is practically made of protein. Diba? Protina, karne. Okay, so kunyari, we have to create, let's say, messengers, protein po yan. We need to create tissue, protein po yan. We have to create new cells, protein po yan. We need to create immunoglobulins to support immunity to fight any virus, bacteria, protozoal, fungal that may harm the body. Yung lalaban po, yung immunoglobulins, protein po yan. So practically everything is made up of protein. Kaya nga central dogma ang tawag. O ngayon, the idea now, pagdating sa dietary nucleotides, is to look for a food supplement, kasi nga dietary, that has the following ingredients. Unang-una, dietary nucleotides, kasi nakikita niya po yung molecular building block ng DNA are nucleotides. Yung messengerial RNA, dala rin yan, nucleotides. Di ba? Tapos kakabit yung amino acid saan? Sa nucleotides. So mahalaga, yung food supplement natin, merong nucleotides. And then, nakikita niyo po in the translation process, kailangan ng amino acids. Di ba? As illustrated. And then eventually, proteins are created or peptides. Ngayon, kung meron kang food supplement na merong additional peptides or oligopeptides, aba, champion yun. So, the question is, can dietary nucleotides support the central dogma of life? Yes, it can. And then especially if you have, let's say, amino acids, peptides, and oligopeptides. Ngayon, gusto natin i-review yung struktura ng DNA. Di ba, pinakita natin na kanina yung struktura. I-review natin yung struktura ng DNA. Bakit po? Lumalabas po ngayon na yung molecular foundation ng buhay natin or the molecular foundation of life is based on three major functions. Una, DNA function. Pangalawa, DNA stability. Pangatlo, DNA repair. So nakita nyo pa ulit-ulit DNA. O di tingnan natin yung DNA. Look at the right side. Nakikita nyo po yung chromosome. Ngayon, sa loob ng chromosome, dikit-dikit na DNA. So hinatak natin ang isang strand to illustrate. Ayan, nakikita natin yung double helix. DNA po yan. Ngayon, nag-focus tayo sa isang DNA. Nakikita na natin yung nucleotide ng DNA or nucleotide DNA. Nakikita niyo yung letra na G and C. Isang pares po yan. Ang pares niyan, GC or CG. Yung pangalawang pares po, TA, thymine, adenine. Basta may thymine, ang pares niya adenine. Pag may adenine, ang pares niya dapat thymine. So, ganun din po, pag may cytosine, ang pares niyan guanine. So, nakikita niyo po sa bandang kanan, sa baba, yung mga letra G, guanine, A, adenine, T, thymine, C, cytosine. Ngayon, pagka ayos yung pairing, that will support DNA function. Ngayon, pag nagkulang po yung nucleotide, that can affect DNA stability. O di, nandyan na naman yung kahalagahan ng nucleotide. Pagkatapos po, yung DNA is usually and often damaged. Maraming factors po, yung ultraviolet rays, pollution, di ba? Stress, chemicals, nasisira yung DNA. O pag nasira yung DNA, disabit na lahat. So, mahalaga yung DNA repair. Ngayon, sa pag-repair ng DNA, involve ulit ang nucleotide. So, you can now see the importance of DNA function, DNA stability, and DNA repair. So, maghanap ka ng food supplement na at least merong nucleotide. Kasi ganun kahalaga yung nucleotide to support DNA function, DNA stability, and DNA repair. Ngayon, ang tawag dyan, yung proseso niyan, genomic medicine. In fact, genomic medicine is the future of medicine. It's the future of medical therapeutics. Ngayon, research is ongoing. And then pinag-aaralan nila ang proseso. Involve ang chromosome, involve ang DNA, involve ang nucleotide. Pagka ongoing po, ano? And then they look forward that they will be able to create, let's say, a therapeutic, let's say, elements that will influence genomic medicine. Ang tawag niya genomic medicine. So yung isa, genomic medicine. Yung pangalawa, genomic health or stability. Ang maganda, genomic health or stability is now successfully being done through dietary nucleotides of life. So ang focus nucleotide pero ang focus dietary nucleotide. Marami na pong research that dietary nucleotide will support almost any a system or function of the body. Kaya nga, doon nga lang sa diskusyon na siguraduhin natin na we have dietary nucleotides in our food supplement because it is now possible through this formulation to support genomic health or genomic stability. Pero yung genomic medicine, matagal pa yan. Pero yan ang trend. Later on, kaya nga you will notice nauna po yung success ng nucleotide supplementation. And it's very basic kasi it is designed to support normal body function, especially at the DNA level. So in conclusion, our body must always be healthy to face any acute health challenge. Yung acute condition, minsan hindi natin maiiwasan o inaasahan kasi nga emergency. Kunyari, nagkaroon ng hip fracture. Healthy ka, healthy. Kaya lang nahulog, nagkaroon ng hip fracture. Acute yun. Aba, napaka-importante, malakas ang katawan. Kasi kung mahina ang katawan at nagkaroon ng hip fracture to undergo hip replacement, major surgery po yan, baka magkaroon ng komplikasyon. At yung pasyente nadali, hindi sa hip fracture. Dadali sa complication like, let's say, comorbidities like nagkaroon ng pneumonia after the surgery kasi humina yung katawan. And then, sa chronic conditions, probably we should be healthier. Bakit po? Nadali na nga Di ba? So, we have to restore health. That's why we should focus on being more healthy. So, yan ang ating conclusion. And then, ang ating suggestion, siyempre, healthy lifestyle, wellness, pero ang focus po natin ngayon, siguraduhin natin that we are able to take dietary nucleotides every day. Bakit po? Yan, tingnan uli natin yung figure sa right side. Yung DNA, which is the basis of our life, because the DNA controls everything, ang nilalaman niya. Yun, adenine, thymine, cytosine, guanine. So, no-brainer. If we can supply these raw dietary ingredients to our body to support the DNA, then we will have a better body, a better life. So ito po inyong kaibigan, si Dr. Arle. Always remember that health may not be everything, but when we lose our health, we might lose everything. So this is the reason why we always focus on prevention, having a healthier lifestyle, and we realize that this is always better than getting the best cure. Mabuhay, and always point to God as our source of power, life, and health.